Hi guys, today we're going to be talking about the respiratory system. The respiratory system, yes, is involved with breathing, inhalation, and exhalation. We're going to be talking about the different parts of the respiratory system, and we're going to be talking a little bit how it works, but more importantly, for this class, we'll be talking about the word parts, the prefixes, the suffixes, and some of the conditions that are related to the respiratory system. So we're going to start off with first some cocktail party talk or social media tales about the respiratory system you might not have known. We breathe roughly 13 pints of air every single minute. Also, yawning, when you yawn, you provide more oxygen to your lungs. It's kind of interesting stuff there. There are 300 million alveoli that may be found in a pair of normal human lungs. Alveoli are tiny air sacs at the ends of our bronchial tubes that are responsible for gas exchange for oxygen and carbon dioxide. When you breathe out, you do breathe out a small amount of oxygen as well, but it's mainly carbon dioxide. And when you breathe in mainly oxygen as far as gas composition goes. All right. Approximately 1/2 liter of water is lost through breathing in an unstressed state. Medical term insensible loss. Urine is a sensible loss. Okay. So 1/2 liter of water is lost through breathing. Recall the function for the nose is to moisten and warm incoming air. So on a cold day, you may get some icicles forming around your nostrils, or if you have any facial hair, or your nose hairs may appear more crystallized due to the cold and warm air mixing. What does the CDC say is the leading cause of doctor visits and missed days from school and work? Well, not a rhinoceros stampede, but if your answer began with the word rhino, you're on track. A cold, most often associated with rhinovirus, is a ubiquitous illness caused by more than 200 viruses. So your common cold, rhino meaning nose. Rhino is a combining form word for nose. There are two major tests of the respiratory system, as I said before. There's external respiration, the exchange of air between the body and the outside, and internal respiration, the transport of oxygen to the cells and the removal of carbon dioxide, which is a waste product for cells in the body. As far as the inhalation goes, so you breathe in oxygen either through your nose or your mouth, and then goes to the pharynx, then goes to the larynx, which is where your vocal cords are. Then the trachea. Trachea is a tube that is by the esophagus. Then we'll have the bronchial tree. Bronchial tree is inside of the lungs. Then we have the alveoli, which is at the very ends of the bronchial tree. Okay. But in the opposite way, so when we breathe out, air containing carbon dioxide leaves the alveoli, goes up through the bronchial tree, up through the trachea or windpipe, larynx, where the vocal cords are, the pharynx, the back of the throat, and then out the nose or the mouth. Okay, take a deep breath. Sorry, no pun intended. Now, it is kind of hard to see, but you have all these different parts of the lungs. Okay? Each one of them will have a meaning. Okay? So you take a look at the ends of the alveoli, the air sacs that are responsible and are extremely important. You have CO2 coming from the blood that's already been used by the cells in the body from the heart rate, goes through the alveoli. Okay. Oxygen then diffuses through the capillaries back into the bloodstream where it gets a recharge. The blood is constantly circulating, hence the word circulatory system. But there's this constant gas exchange between CO2 and O2, oxygen and carbon dioxide. So your body, whenever it uses oxygen and cells respire, as in get rid of any waste products, that waste product is carbon dioxide. Carbon dioxide goes back up to the heart. Heart squeezes the blood to the lungs. The lungs then give the blood a recharge with oxygen, because without oxygen, our tissues would die. So, select the pronunciation of the anatomic structures defined. Muscular partition, diaphragm, space between the lungs, mediastinum, food and air passageway, pharynx, location of vocal cords, larynx, air sac at the end of the bronchial tubes, alveolus or alveoli. Keeps food out of the trachea and larynx, so when you get food or water in your windpipe, that means the epiglottis did not do its job. The bronchi is the bronchial tree. Larynx is the voice box, also called. Pharynx is also called the throat. Adenoids are the tonsils. Trachea is also called the windpipe. It's a bunch of different sites. NIH, American Lung Association. Don't hesitate to go and look there. So here are some word parts related to the respiratory system. We have the nose, which is otherwise known as a naso or rhino. The pharynx, which is right here, is also called pharyngeo. The larynx, laryngeo. Trachea, tracheo. Bronchi is bronchio, broncho. Alveoli is alveolo. Okay, broncho is also called bronchus for singular and bronchi for plural. Larynx, laryngeo is a larynx. Pneumano is lung or air. There's also one more word for lung, that's pulmono. Now here's some extremely important suffixes. You will use these in the rest of the chapters. We have ectomy, which is surgical removal or excision. You have a stomy. So anytime you make an artificial opening, it's a stomy. Then you have a tomy, which is anytime you cut into something or incise. From chapter 4, you have tomo, which means to cut or section. So a dermatotome. All right, that's an instrument used to cut skin. But ectomy is going to be used a lot. Stomy is going to be used a lot. Tomy as well. Now here's some extremely important suffixes as well. So this chapter really infuses 3 important suffixes. 6 actually. We have the gram. So I always think of Instagram like a picture. A telegram, a radiographic image. Anytime you see the word gram, that is a image or radiographic image. So something associated with an MRI or an X-ray. Okay. But when you see the word phonograph or graph, that's an instrument used to record. So any device recording something is going to be referenced into a graph. But then you have the word graphy. So you have gram, graph, and graphy. Anytime you see the word graphy or suffixography. That's the process of recording something. So you have radiographic image, right? Photography. It's a process of recording a photo. We have meter, instrument used to measure, and metry is measurement. Here's some prefixes. You have an, and then an at the beginning of the word, which means absence of or without. You have endo, which means within. EU is normal or good. So eupnea, normal breathing. Poly, so we're not talking about poly pockets, but poly is not singular, but many or much. Tachycardia, usually a reference to that, but you have tachypnea, which is faster, rapid breathing. Tachy means fast or rapid. Tachy, get in their outfit as fast as you can. Which of the following is the combining form that means chest or chest cavity? Well, we're looking for combining form words, right? So we're not looking for suffixes. This means lung, or plural, which means the lining of the lungs. Okay. Thoraco would be your answer. Which of the following is a suffix that means chest or chest cavity? Suffix now, right? It's right here. Thorax. Disease disorder terms, spill from word parts, grouping a few other combining forms. We have nasopharyngitis, so inflammation of the nose and pharynx. Okay. You have pharyngitis, inflammation of the pharynx. Laryngitis, inflammation of the larynx. Laryngeotracheobronchitis. Whew. So you have inflammation of the larynx, the trachea, which is the windpipe, and also the bronchial tree. Pneumono, that means lungs. Both those mean lungs. Okay. All right. Condition of the lung. Pneumonia. Okay. Pneumonia. You have pneumothorax. Okay. In reference to the thorax and lung. So, fill in the blanks with the right. With the right term. So, we have air, which is pneum, combining vowel O, pneumothorax. So, we have air in the chest cavity. Hemothorax, blood in the chest cavity, so we have a lung injury. Atelectasis, incomplete or imperfect expansion of the lung, right? So the alveoli is collapsed or damaged. The lung is not expanding. Okay. With normal breathing, the lungs inside this lining will expand and also shrink. Atelectasis. Bronchoscopy, which is similar to the lungs not completely filling up, right? You have the bronchioles, they don't completely dilate. Or, in this case, the bronchi would dilate too much, okay? Chronic obstructive pulmonary disease. There's two components. We have emphysema. As you can see, the normal alveoli have certain separations or partitions. you can see that there's 3 different cavities. But when you have emphysema, the alveoli will actually meld together and become one giant alveoli, right? They'll be puffy. What that's going to do is going to cause a pressure imbalance. Your gas exchange is not going to be as perfect as with a healthy alveoli. Then you can see with bronchitis, we have the inflammation of the bronchial tubes. With that, you have some redness or some puffiness, some inflammation. Anytime you have inflammation, anytime you have inflammation, it's going to be red. The size is going to be increased. They're not going to be working as well. So bronchitis is inflammation of the bronchial tubes. And that happens with cough, anytime that you have mucus production in the lungs. So, in the test performed to identify the presence of an agent that causes tuberculosis, well, that would be a acid-fast bacilli smear. Obstructive sleep apnea. Okay, with that, we have a normal airway, right? Air goes through the mouth, the pharynx, the larynx, right? The epiglottis is here, right? Allowing the air to go down. But when someone has sleep apnea, you can see that the tongue will actually close and prevent air from getting to your body. People can actually pass out and die from the lack of oxygen because of this obstructive sleep apnea. Your organs will not get the oxygen that they need. Now, you can have certain surgical procedures, but you need to have it diagnosed first, right? So a polysomnography, process of recording many sleeps. Okay. So they're studying your sleeping pattern. Then you have surgical. You have uvulopalatopharyngeoplasty, so that's surgical repair of the uvula, palate, and pharynx. But then also you have a CPAP. CPAP machine is constant oxygen pressure or air pressure to open up that airway. So when someone does sleep, that the closed airway is actually going to be opened. Pulmonary emphysema and bronchitis are components of this disease. That is chronic obstructive pulmonary disease. Okay, then you have lobectomy, right? You have a pneumonectomy, which is a excision of an entire lung. You have a segmental resection, which just takes off a small amount. You have a lobectomy, just taking off a small amount. You also have a wedge resection as well, where they actually cut into or resection the lung.
Did you call? Did you pay?
1 second. No. That was Mr. Pomplin.
Oh, okay.
All right, sorry about that. So let's go back to our lesson here. So we started with, we left off with a lobectomy. Which procedure would best serve Pinocchio's needs, if not telling the truth? Surgical repair of the nose, which is a rhinoplasty. Bronchoscopy. So visual examination, indications. So anytime you're looking at the bronchial tubes, right, you can use a bronchial scope. Goes in through the nose, down to the larynx, pharynx, through the trachea, windpipe, into the bronchus. Okay, bronchoscopy. is either to obtain a sample of the lung tissue, evaluate abnormal radiograph or an X-ray, retrieve a foreign object, and investigate a cough. Laryngoscope, so a device to inspect the larynx, right? So the endotracheal tube, which is within the trachea, of a laryngoscope. You have a pharynx, which is the upper part of the throat, the larynx, and whatnot too. Nurse anesthetist inserts a endotracheal tube with a laryngoscope to guide the tube in place. So this is to open up the it's a breathing tube essentially, right? Capnometer. This measures carbon dioxide. Pulse oximeter measures oxygen within the blood. You have the spirometer, which is measurement of breathing, right? So a device to measure breathing, a device to measure oxygen, device to measure carbon dioxide. Radiography. Radiographic images of internal organs using ionized radiation or X-ray. Nuclear medicine scans using radioactive material to determine the functionality and capacity of an organ. Ultrasound, sonographs, echograms using high-frequency sound waves to create an image of the body. CT scans, computerized images of the body in slices horizontally. Magnetic resonance imaging. MRI scans give the information about the body's biochemistry by placing the patient in a magnetic field. Endoscopy. Endoscopes, which are lighted, flexible instruments, are used for visual examination of a hollow organ or body cavity. A laboratory, where things are processed, such as snot, blood, tissue, urine. Pulmonary functions test to perform to determine lung functions. Oscillation and percussion. So you are listening, you are tapping for and listening for different sounds within the chest cavity. Hypomuco, so hypocapnia, that is condition of deficient amount of carbon dioxide in the blood. Hypopnea, deficient breathing. Hypoxia, which is a deficiency or condition of deficiency within oxygen. Muco or mucoid, resembling mucus, and then this is pertaining to mucus, right? Mucus or muco. Acapnia, hypocapnia, hypercapnia are terms in describing the amount of carbon dioxide in the blood, not oxygen. Phono is sound or voice, so you have aphonia, condition without voice, condition of difficult voice or sound. Right? So you have problems speaking, losing your voice, dysphonia. And nebulizer. So nebulizers help people with asthma. It helps to deliver the medication much easier. Name two terms which have two distinct meanings. Passageway by which air enters and leaves lungs. Mechanical device to keep air, and passageway obstructed, endotracheal tube. Passageway by air enters and leaves lungs, that is trachea. Aspirate is centesis, to withdraw fluid or suction fluid, or to draw foreign material into the respiratory tract. You have term categories, diseases, and disorders. You have thoracolgia, which is pain in the thorax or chest area. Surgical procedures, thoracocentesis, to aspirate fluid from the chest cavity. Diagnostic terms, thoracoscopy, the process of visual examination of the chest. Complementary terms, so thoracic is pertaining to the thorax. Radiographic image of the chest performed to evaluate the lungs. That's CXR, chest X-ray. CT scan. CAT scan. You've ever heard that before. So computed tomography scan, so CAT scan. What is abbreviation for the two medical scan tests to diagnose or rule out pulmonary embolism? VQ scan. Lily, whose husband was asked by a pulmonologist to get his snot or sputum analyzed, didn't understand his need to stop at the opera first. What diagnostic test do you think was ordered by his physician? So culture and sensitivity. TB is tuberculosis, SOP, shortness of breath, HAP, hospital-acquired pneumonia, a disease condition or condition disease of the lung, a COPD, chronic obstructive pulmonary disease, OSA, obstructive sleep apnea. All right, almost done here. 24-year-old man visited the emergency department because of dyspnea, hyperpnea, and paroxysm of cough and presence of thick, tenacious mucus. He had a history of asthma since the age of 12. His chest radiograph is negative for pneumonia. Disease state of the lung. Arterial blood gases showed hypoxemia. So that is a lower level of oxygen in the blood, but no hypercapnia, which means that no above or excessive state of carbon dioxide in the blood. Pulmonary functions test disclosed bronchoconstriction. So with a breathing test, his bronchial tubes were constricted or narrowed, which is corrected by a bronchodilator, which is something like your nebulizers, your inhalers. Was prescribed for treatment. The asthma attack was probably precipitated by an episode of bronchitis, which is inflammation of the bronchial tubes. Whew. All right, so with that being said, we'll stop here, and so that's it. Let's study up, and hopefully this was easy, or not easy. This was a help for you with your study.